Hi, my name is Kristen and I'm a nurse practitioner. Next, I want to talk to you about HPV. So what that stands for is the human papillomavirus, and this is the most common sexually transmitted disease out there. Now for the guys, there is no test on the market to know whether or not you're infected. So often, the first time you might be hearing about HPV is if your partner comes home and tells you that they had an abnormal pap smear, which I'll talk about a pap smear in a minute, and that test will often test for the HPV virus. So that might be the only way that you know that you may possibly be infected. So for women, starting at age 21, it's recommended that you get what's called a pap smear. And the way that we do a pap smear is we insert a speculum, it goes into the vagina, and then we get a sample of the cells from your cervix, and that gets sent out to the lab. Now, if the cells are abnormal, they're gonna automatically test for that HPV virus. And then there are treatment options depending on what your pap results are. Some patients require what's called a colposcopy exam, and that's where I would actually take a closer look at your cervix to see how that virus is affecting it. Sometimes I'll have to do a biopsy of the cervix as well as take cells from inside the cervix. And then we send that out to a pathologist who will let us know how that virus is affecting your system. Good news about the HPV virus is the really aggressive strains that we know can cause cervical cancers, some of the anal cancers, the oral cancers. It can actually be prevented by getting the Gardasil vaccine. We do offer that vaccine here at the office for patients who have not been vaccinated. The vaccine, it's 3 doses, so you would get it, let's say you came in to see me today, we would give you your first shot, you come back in a month, and then after that you come back in 6 months and we give you your last dose. And what that virus does again is it protects you against the high-risk strains that we know can lead to cervical cancer, and it will also protect you against genital warts. So genital warts are part of the HPV virus. And warts, they can be really hard little bumps that develop in the genital area. Sometimes it actually looks like the top of cauliflower. And one of the treatments that we have in the office, there is a solution that we put, it's an acid that goes directly on the wart. That wart will turn white, then it turns black, and then usually that wart will fall off. Majority of patients, once we do a treatment like that, they tend not to get a reoccurrence, but it all depends on your personal immune system. So if you're someone who's like really high stressed, or you have someone who has, let's say, an autoimmune disorder, or you're really, really sick, or you're going through a stressful event, you can get a reflare-up of those genital warts. It's also super important to know with HPV, there are over 100 strains that can affect you. And the Gardasil, it actually only protects you against 9 strains. So even if you do get vaccinated, it's important, especially for women, that you come in for your routine pap smears, because we can detect other strains that could be problematic down the road that could also lead to cervical cancer.